Knowing how to pump and store breast milk can be an important part of feeding your baby. Begin by washing your hands. Make sure all bottles and parts of the breast pump are clean before each use. Assemble the pump. Then find a comfortable spot to sit. Breast shields come in different sizes. Choose ones that allow your nipples to move freely inside. Place a shield over each nipple. It should be centered over your areola, the dark circle of skin around your nipple. Now, turn on the pump. Adjust the speed and suction to a level that feels comfortable. To avoid nipple damage, use the lowest setting that allows milk to flow comfortably. If you're using a manual pump, control the speed of pumping by squeezing the handle. It might take a few minutes for your milk to start flowing. It can help to be near your baby, to look at a picture or video of your baby, or to smell an article of clothing. Try to relax as best you can. Once milk begins flowing, it's called letdown. Pumping usually takes about 15 to 20 minutes. Pump until your breasts are empty. That's when milk stops flowing or the flow becomes weak. When finished, store milk in clean, sealed bottles or in pre-sterilized breast milk bags. Label each bag or bottle with the date and use the oldest milk first. At home, breast milk can be stored at room temperature for up to 4 hours, in a refrigerator for up to 4 days, in a freezer for up to 6 months, or in a deep freezer for up to 1 year. To defrost breast milk, thaw in the refrigerator overnight or place in a bowl of warm water. Make sure the container remains tightly sealed. Never microwave breast milk. Use defrosted milk within 24 hours. Do not refreeze. Once your baby has started to drink the milk, it's only good for about an hour. Throw away any leftovers. Follow the manufacturer instructions for how to clean the parts of your breast pump. If you have questions about pumping, storing, and giving your breast milk, talk with your doctor or lactation consultant.